Good day. I'm Dr. Lanny Nelson, and I'm one of the team chiropractic physicians here at Brigham Young University. I have a lot of experience on using the Protect device in the sports medicine environment. This real brief introduction is just to kind of show you the mechanics of it, how the apparatus works, and some of the anatomical features that we find most suitable in a sports medicine environment. The machine itself is first equipped with a cervical harness that we use for cervical and brachial and thoracic work. These are called arm slings that are used to suspend the arms. These are called the leg slings that we'll talk about when we look at decompression on the lumbar spine. And this is an articulated seat, which is able to go up and down. And in doing so, I'm able to offload the lumbar spine in relationship to how much decompression I want to use in the posterior elements. Okay, let's stop. Okay. You've seen now that I've taken one of our graduate assistants here at Brigham Young University and placed him inside the machine. In the machine here, you'll notice that I have his legs in the stirrup, I have his lumbar fixated, and then I've given him the control that allows his seat to go up and down. So go ahead, Billy, drop a few pounds off it, and you can tell that I can gauge how much pressure that I take off his spine based on the depth of drop. What I usually have my patients do is go till it's comfortable to begin with, and then go ahead and drop till you feel free fall on the bottom and you feel like your buttocks not touching. At that point, you'll notice that I've opened up his posterior column, and at that point I've taken pressure off his disc space. Then it's easy for me to manipulate the posterior column and manipulate the disc space while he's in a free-floating state of decompression. You feel yourself open there now?
Yes.
Once he's in this position, it's easy for me now to rotate the spine and put traction either in a rotatory position or I can put it in AP glide position. What I find most effective for managing low back athletic pain is it's easy for me also to adjust the SI joint by applying distraction on the posterior part of the hip. And one can do that by taking his leg, putting an axial load on it, and you feel me open up your spine. Can you feel that?
Yes.
That's pretty comfortable. And that feels really easy when I pull you open like that. You can feel me open up your spine. If I do both legs at the same time, you'll see me open up your spine in this position here. If it's more comfortable in flexion as it is in extension. Okay, go ahead and stop. One of the most fundamental things we have in back pain, especially in athletes, is being hamstrung or having so much tension in the IT band, the tensor fasciolata or the glute medius, which restricts back movement. Once I get an opportunity to do that, I like to put my athlete in this position, and as I pull him in this position, he can feel the tension along that IT band, and he can feel the tension in his hamstrings. The neat thing about the Protect device is by using this sling, I can raise or lower and find the exact space where I can find where that part of reactive splitting inhibits his low back condition. One of the best advantages of the Protect machine, in my opinion, is using it for cervical brachial dysfunction. You notice now that I have him set up with no pounds on the meter, and I've got his hands in abduction and extension. And what I can do is I drop him down, and I start to load his neck with about 7 or 8 pounds of pressure. Right here, he's down, well, that's about 12 pounds there. When I put him at 12 pounds of pressure, with his arms in this position, I've taken all the tension out of his neck and his shoulders. So right now, this whole upper quadrant is relaxed. So for brachial plexus, stingers, neck facet impingements, all those kind of situations can be managed because I've taken all the pressure out of the neck. It's also easy for me to come in here now and immobilize his neck in this position or in this position where you can actually mobilize the neck with taking all the reactive splitting out of the upper part of the neck and the shoulders. A lot of our athletes have a lot of first and second rib problems. Thoracic outlet, which is pretty common. In this position as well, I can put my hand in here, bring my hand over the top, and once again I can mobilize his neck and his ribs in this case because I've taken all the tension off the neck and the shoulders. There are many possibilities on how to use this, but I find that this apparatus is most effective for giving you predictability, a high rate of intra-rated reliability, and a successful outcome. I hope you've enjoyed this brief video. Please feel free to contact me should you have any questions.